In the run up to the World Diabetes Day, which is celebrated on 14th November every year, we are here to help raise awareness of this condition. I, Vasundhara Agrawal, MSc in Clinical Nutrition and Dietetics, would like to welcome Dr. Usha Ayagari, who is an MBBS, MRCP, MRCPE, CCT. She's done a specialization in endocrinology, diabetes mellitus, and general medicine. She is an FRCP from London, and over her vast experience, she has helped thousands of patients to lead a healthy lifestyle. I would really like to welcome Dr. Usha Ayagari.
Thank you very much, Ms. Vasundhara. It is indeed an absolute pleasure to join you today in our discussion.
Doctor, we all know that practicing a healthy lifestyle may prevent most of the diseases in general. However, we have received many questions about diabetes and its effect on our day-to-day life. I would like to ask you certain questions to help our audience understand how they can manage diabetes better. If I can start, Dr. Usha?
Absolutely.
Great. Dr. Usha, my first question to you is, what is diabetes?
This is a very good question, Ms. Vasundhara. Most people associate eating sugar with diabetes, and they come to me and say, but I don't eat any sugar, doctor. I don't eat any sweets. Actually, diabetes is a condition in which we see high blood sugar levels. But if you look at the broader picture of diabetes, there are many, and I mean many changes in the body that ultimately lead to this high blood sugar level, which allows us to diagnose diabetes. You can have a deficiency of insulin. It is also possible that the amount of insulin you have in your own body, you may not be using absolutely efficiently. So it's called insulin resistance. So you have a deficiency of insulin, you can have insulin resistance. But there are other mechanisms which contribute overall to this increase in blood sugar. You just mentioned about lifestyle and prevention of diseases. If you really wanted to look at lifestyle and diseases, diabetes really is the poster child. Type 2 diabetes is the poster child for something that can be modified or prevented with intensive lifestyle intervention. So although people's common understanding is that it's related to sugar or sweet intake, the picture is much broader than that. And I hope that over the next, 30-40 minutes, we can bring more light to this.
Definitely, Doctor. Doctor, you rightly pointed out that, it's a vast thing, and we can protect through lifestyle changes. I think there's a difference. Doctor, if you can help us understand, what is the difference between type 1 diabetes and type 2 diabetes? There's
Indeed.
a big confusion on the same.
That's a very good question. Most of us deal with type 2 diabetes, and most of us will know someone living with type 2 diabetes. But type 1 diabetes is very important. Usually affects children and the younger population up to maybe the age of 40, generally younger. And when you think of diabetes, we have an organ called the pancreas that lies about the level of our belly button, which produces a hormone called insulin. When you have type 1 diabetes, because of various processes, usually antibodies, the cells that produce insulin are attacked and completely destroyed. So your body doesn't produce any insulin at all.
Okay.
Type 1 diabetes is an absolute deficiency of insulin.
Okay.
You have no insulin and you must treat with insulin to survive. Okay. Whereas type 2 diabetes, you have some insulin deficiency, but remember where I mentioned insulin resistance?
Right.
Can't use that insulin efficiently. So you have a combination of mechanisms. Majority of us will see type 2, and type 2 is the one that is modifiable to a great extent with lifestyle.
Got it. So, doctor, what are the symptoms which we can easily identify if the person has diabetes or not? Like, you never know, a person might be having diabetes, but they don't know that what is leading to this. How can they easily identify it?
You know what, Vasundhara, that is one of the most important questions, and you nailed it. We don't know. Up to 50% of people with diabetes don't know that they have diabetes. And relying on symptoms is very unreliable. If you were to have symptoms, a child, for example, may be losing weight, may not be growing as you expect.
Okay.
Children who've stopped bedwetting may restart bedwetting.
Okay.
They may be prone to infections, but they can get sick really quickly with type 1 diabetes. But when you look at adults, unless your blood sugar levels are significantly high, most people, where they grow up gradually and they increase over a period of months to years, right away the symptoms to general life. So you can feel tired, you can feel thirsty, you can maybe urinate more. With high blood sugar levels, you can lose weight. You can have a loss of concentration, you can have headaches. The symptoms are very generic. And by the end of a day, if you feel tired and you have a headache, most people put it down to life rather than thinking, let me go check my blood sugar levels. So my advice would be, don't rely on symptoms. If you have symptoms, for sure, get it checked out. But if you don't have symptoms, there is something called the Indian Diabetes Risk Score. So for example, if you're sedentary, if you're overweight, if your parents have diabetes, and if you score high, you can just Google it, Indian Diabetes Risk Score, widely available. You'll get Google images. And if your risk score is high, don't rely on symptoms, go get the blood test. It's simple, it's easy.
Totally agree. Totally agree. I think we should be more relying to our, doing blood tests rather than just looking at symptoms, because thanks to Google, just looking at so many symptoms, people tend to feel that they have this health condition, they have that health condition, wherein when they just go for the routine checkup, they have like nothing. It's just in their head. So
See, nowadays, most corporates offer employee health checks.
Right.
And yet the percentage of employees that take advantage of those health checks is minimal.
I know.
It's on offer. Please use it, because that's the quickest way.
Yes. In spite being educated, people are scared to go for their annual health checkups.
Indeed.
Even when the company or wherever, like a lot of places, they're trying to make it free so that they come to know they can diagnose their health condition earlier and start treating it. But that fear of testing is something which we need to work on.
Absolutely. Nailed it.
Doctor, also wanted to know, like you mentioned about type 1 diabetes. So what is the age, like how early it can start, like? And I have also heard that a lot of children are, having type 1 diabetes. So what is their treatment line? How can we take care of children with type 1 diabetes?
Absolutely. So, as you rightly said, it's children usually, although you can see it in young adulthood. Unfortunately, our societal norms, if you will, or perhaps the lack of knowledge and the lack of empowerment, we as healthcare professionals really need to give more information to the patients, mean that children with type 1 diabetes lose out on a huge extent of childhood because the parents understandably are cautious. But with the right treatment, and I'm afraid for type 1 diabetes, it is lifelong insulin. Anybody that tells you that a child or a young adult with type 1 doesn't require insulin, I'm sorry, but they're wrong, plain and simple. But with the correct treatment, with insulin, and with a healthy lifestyle, and I'm talking about eating healthy, I'm talking about sleep, I'm talking about stress management, kids around exams, I'm talking about exercise. There is practically, virtually nothing that a child or young adult with type 1 can't do, and absolutely no major restrictions as long as they have the knowledge, as long as they have the skills to manage their type 1. And they should be seeing a specialist who can teach them those skills. Because you live with type 1. You see the doctor, once in a month, once in 3 months for 15 minutes. But really, you need to understand how your type 1 behaves and what to do for it.
Got it, doctor. So, doctor, like you mentioned that, eating right, sleeping right, and, medications all go hand in hand. So, I would like to ask you about the diet aspect. Like, is there any specific dietary restrictions that needs to be followed for people who are diabetic? And is there any difference in the diet regime for type 1 diabetes and type 2 diabetes?
Very good question again. So, broadly, if you want an umbrella answer, a healthy diet for an individual living without diabetes is a healthy diet living for an individual living with diabetes.
Okay.
Online, all of us should be eating healthy. This is not reserved for those living with diabetes.
Totally agree.
All of us need to know a little bit about healthy eating. Number two, to be honest, I sometimes feel that managing diet in type 1 is easier because, especially if a young adult with type 1 is using a mealtime insulin or an insulin pump, and these are various regimen for managing type 1. Every time you eat carbohydrates, which is one of our major food groups, you give yourself a small bolus of insulin. But I will not say there are no restrictions because remember, I started out with the caveat that a healthy meal plan is important. But within that healthy meal plan, type 1 is almost easier to manage than type 2 because they're on mealtime insulin, and especially if they're taking short-acting insulin. But broadly speaking, all of us should be aware of what our major food groups are: carbohydrates, fats, proteins, where we get carbohydrates. People with diabetes again come back to this: I don't eat sweets, I don't eat sugar, or I don't eat rice. But remember, it's not just rice. Wheat, dalia, millets, everything has carbs in it, right? Gee, people tell me I eat only millets, doctor. Well, millets are 75% carbs nearly. So there are healthier options, obviously, within carbs rather than maida and white rice. Certainly, dalia and millets, for example, are a better option. Wholemeal or whole grain or multigrain, a better option than maida. But carbs are carbs, and we need to try and restrict the total amount of carbs that we have. For people with diabetes, about 50 max 60% of your daily calorie intake, if it comes from carbohydrates, and as much as possible from complex carbohydrates, so those with a lot of fiber, it's always easier to manage your diabetes. Also, make sure that you have protein at every meal and that you restrict the amount of fat. So, and this is a general eating plan for all of us, living, breathing individuals.
Right.
Healthy, we need to cut back a little bit on the nice but naughty things in life and stick to eating healthy most of the time with maybe an occasional treat to keep us going.
I totally agree. Doctors have started teaching their patients to do carb counting, which actually helps them understand that which is good carb, which is bad carb. A lot of them are like, we are on no carb diet. That's practically not possible.
That's just not sustainable. You know this, right?
Yeah, there are like misleading information when people come and tell me that I'm not having carbs at all. I'm like, has your doctor educated you about it? Then they come to know, oh yeah, this is what they meant.
Exactly.
So they need to revise on their diet. Just like, it's just not that one day they attended the session with doctor, it's done. They need to practice it every day so that they don't skip on it.
And especially what you mentioned, carb counting, I think is a critical life skill for someone living with type 1.
Exactly.
The amount of insulin they dose totally depends on the amount of carbs they're eating. Previously, we used to actually we had to memorize and we had to teach patients to memorize carbs. But now, anyone with a smartphone in their hand can just look up the amount of carbs for any given portion of food. And if you can learn to read labels, you're halfway there.
Totally agree.
It will become a lot easier since we have a smartphone in our hand.
Yes, label reading is something I always recommend my patients. Like, please read the label, see what you're eating. Just don't keep on pumping insulin or taking medicines as and when needed. In this festive season, I heard so many of them like, mithaiyan khali thi, so we had more insulin. So now it's balanced. I'm like, they don't understand that you need to have a balance. You need to know how much you have to take and how much you have to eat.
See, a little bit of indulgence I think is necessary because you need to live life miserably.
I totally agree, but
the key word here is balance.
It's the balance, yes.
And burn it off. That's the second phrase for me. If you're going to indulge, you've got to burn it off because it's your health, your body, your responsibility. Yes, live a little, balance it out, and live healthy.
So, doctor, like you said that you have to indulge, you have to live a little, plus have the balance.
Absolutely.
So, is there a way where we can treat diabetes, or can diabetes be reversed? If yes, then
Oh,
how?
wow. Look, great question. Remember, I said diabetes, type 2 diabetes is the poster child for lifestyle management. Honestly, I'm not joking. Now, we go through three stages, if you will. We have normal blood sugars. We have something called pre-diabetes. Some people label it as borderline, but that's not the correct term. And pre-diabetes is that stage between normal blood sugars and diabetes. But at all stages of this journey, whether you have normal blood sugars but you have a high risk, for example, the Indian diabetes risk score, whether you have pre-diabetes or you have diabetes that's newly diagnosed or you've had it for a decade, your lifestyle choices determine the balance between medication and control. The key pivot holding together all these is your lifestyle. Now, at the stage of pre-diabetes, lifestyle management can reverse back to normal blood glucose levels. Now, when it comes to diabetes, I don't like to use the word reversal because the more accurate description would be remission. In that it's something you're actively managing and monitoring. Just reversed it and said, that's it, we are done.
No.
Anymore, or you don't need to be healthy anymore, or you don't need to check anymore. It's remission. It can be managed without medication, certainly early on. So there are a few studies. If you have intensive lifestyle management, especially within the first 4 to 6 years after diagnosis of diabetes, and if you make adequate changes to your lifestyle, primarily centered around activity, I'm sure we'll discuss lifestyle changes and weight loss, you can bring your diabetes to a point where you're managing it without medication. The key is managing, actively managing. Medication is not the only management for diabetes. Lifestyle is the pivot.
Yes.
Unfortunately, at some point in the type 2 diabetes journey, remember I said type 1 needs insulin from day one. Lifestyle is important, but we can't stop the insulin. Now, with type 2 diabetes, most people will go on to require medication at some stage of diabetes. Say you've had it for 5-6 years, you've managed it without medication. There may come a day when you may need medication. And we are seeing type 2 diabetes at a much younger age group. When we think of our grandparents, you saw type 2 at 60. Maybe our parents had it at 30, 40, 40s, 50s.
Yeah, it's changing.
In 20s and teens. Unfortunately, a majority of these people are going to go on to require insulin for control and to stay healthy. So whilst lifestyle is the pivot, please don't ever rule out other interventions. If you need medication, have that conversation with your doctor. Be open. If you have reservations, please express it. And I'm sure as doctors, we are happy to discuss why we recommend a particular course of action and what the alternatives are. But keep an open mind and have that discussion.
Yeah, I feel educating the patients rightly that this is not going to harm you. A lot of them have that thing that if we start insulin, this will never end. This will create more trouble in our body. They don't understand that if they don't take insulin or if they don't take medicine, it's going to create more damage. So that education, that asking to the doctor is something which I feel we need to do. They shouldn't fear asking that, why do I need the medicine? What is the repercussion?
Why fear? Look, it's your health, it's
exactly.
your body. It's you who's living with this condition. Ask your doctor, have that conversation. In fact, this is very topical because the theme for the World Diabetes Day this year is diabetes education, as you know.
Yes.
Educating the person living with diabetes, educating the people supporting the person living with diabetes, and it's really key to managing diabetes.
Yes, yes. Sorry. It's just not fear, it's also negligence or, maybe running away from a situation that Okay, let's see, let's try it out, and then obviously asking 1,000 people that how did you manage, uh, and going
Oh,
in hearsay, and there I feel they lose their early years of detection, where they can actually reverse the not reverse, but they can control their diabetes, where they do not need to take medicines further. They just need to modify the lifestyle and keep a healthy check.
you're so right. Because, for example, social media, I won't take any one particular platform, from both the boon and the bane of our existence. For
Correct.
this talk, right? People can listen to it and get information. But on the other hand, there are, let's call it WhatsApp University, amount of misinformation and disinformation, both that goes out there. Look, information from any source that can be trusted, yes. But if you see something and you have questions about it, discuss it with any healthcare provider. It doesn't need to be a doctor. You can talk to your nutritionist, you can talk to your diabetes nurse, you can talk to anybody in the healthcare field. But make sure you get the right information.
Correct.
Don't rely on my grandfather's neighbor's, somebody who said
The anecdotes.
saying whatever, and therefore, remember your health at the end of the day. So put your trust in the right place.
I totally agree. So,
We both
doctor,
see
like,
this, don't we? And the consequences of having to maybe readdress those issues, we both live with it.
yeah. So, doctor, like, is there anything like because of diabetes, does the quality of a person's life also gets affected? Or, like you mentioned earlier, that they have polyuria, bedwetting for children, or weight loss, rapid weight loss. So, what are the changes? Like, what all difficulties? How is their basically quality of life affected because of diabetes?
So the symptoms you mention happen in people who don't have good diabetes control. So the best thing you can do for yourself to improve your quality of life is to actually work with your healthcare provider team. And I say team because diabetes is never just doctor and patient.
Correct.
You need to get good control. There will be dietitians involved in that. There will be diabetes nurses, maybe foot care professionals, the wider ecosystem that will help support you in that journey. Now, I think that healthcare, mental health, and quality of life are things that we don't address enough in diabetes, because it's only the person living with diabetes that truly understands the burden of living with diabetes. And it's very difficult for even carers to quite understand the pressure maybe that some people feel. Again, we should, as healthcare professionals, be offering screening because people with diabetes have a huge burden of depression, for example, unscreened for, probably undiscussed in a 10-minute diabetes appointment. But we as healthcare professionals should be bringing it up. We should say, how do you feel about your diabetes? Is there anything else we can help you with? It's not just a prescription. It's not just a bunch of pills that you swallow. But I think as people living with diabetes, you must feel empowered and enabled to go to a trusted source. It could be a healthcare professional, it can be a counselor, it can be a friend who's supportive but knowledgeable, and say, this is what I'm struggling with. Because remember, we do try to do our best, but in a 10-minute appointment, for example, if I see a blood glucose of 300, I may not have time to address your anxiety, which really is something that is a huge part of diabetes control. But I want you to bring it up. I want you to ask me, and let's have those conversations, because I think in India, especially culturally, we don't talk about mental health enough. I think we really need to move in that direction.
Yeah, so I think throughout these sessions, which we put it up online, because, like you said, social media and internet is boon and bane, but we are trying our bit to educate in some way, so that at least, maybe a little percent of the population also sees and learns from this. They are definitely going to pass on this information further, and it might help someone to improve their overall health.
Exactly. Every little bit helps in this space.
Yes,
Every bit
yes.
of accurate information helps. Absolutely.
Yes, yes. Doctor, so like you also mentioned earlier that we need to have balance to manage diabetes. Okay, so how important it is to stay active, uh, to have a healthy, active lifestyle to manage diabetes.
So, exercise is essential for all of us, not just the privilege or the responsibility of someone living with diabetes. We need to have a combination of exercises, and every single one of us needs to exercise for heart fitness. And the general recommendation for that is to do at least 30 minutes of exercise every day for 5 days a week. So 150 minutes a week. But for people living with diabetes, the goals may be different depending on your blood sugar control, depending on the need for weight loss. Especially if you have other health issues with diabetes, high blood pressure, heart issues, kidney issues, please do talk to your doctor about what is safe and recommended for you. Even for people living with type 1 diabetes, there are absolutely no barriers. In fact, I'd say exercise is essential. But the timing of exercise and the adjustment of snacks and insulin may need to be discussed with your doctor first to make sure that it's safe when you're exercising and that you don't have low blood sugar levels. For women around menopause, so women around 50, you lose bone strength really quickly. So doing weight-bearing exercise, so something like walking, is extremely important. Our society also has perhaps this myth that the elderly can't exercise, don't need to exercise. In fact, exercise is critically important for the elderly because as we age, we lose muscle mass. And that means that we lose muscle strength. And when we lose muscle strength, we become more prone to falls. That can give us fractures and that can affect our quality of life and make us dependent. A combination of training. You can use a couple of bottles of water, you can use resistance bands, you can use your own body weight, and you can go to the gym if you're so inclined, but you need to do something to strengthen your muscles in combination with some aerobic or cardio workouts. Again, have the discussion with your doctor, see what is recommended and safe for you, and take it from there. But exercise, every single one of us should be moving every day. The second thing I'd like to mention is exercise is not the be all and end all of it. We know that even if you exercise for an hour, if you're sedentary for 2 hours after that, you're starting to lose the benefits of that exercise. So get up and move. If you've been sedentary for an hour, make some excuse. Okay, you need some information from someone, get up and walk to the desk. You're taking a phone call, get up and walk. Keep moving. So exercise, yes, but keep active and keep moving through the day to stay healthy.
I totally agree on that walk and talk part.
Easy, right? Easy to build it in. Using stairs at work, walking and talking, taking your meetings on the move, all helps. Every little bit helps.
Definitely, definitely. Doctor, and like looking at the modernization, how does smoking and drinking also affect diabetes? Like, do they have any relation? Um, we haven't spoken about smoking and drinking at all.
Indeed. And again, very good points. So let's look at, remember where I said at the beginning that diabetes, although we look at the blood sugars, it's a broader spectrum.
Correct.
There is a common soil, unfortunately, in which several seedlings become a major forest. Diabetes, high blood pressure, bad cholesterol levels, risk of heart attacks, risk of strokes. All these, unfortunately, grow like a wild bush in that particular soil. It's related to your metabolic health. Now, smoking also is a major risk factor for all of the conditions I've mentioned now. So for strokes, for amputations, for heart disease, smoking is a major risk factor. For somebody who has diabetes, who already has one big risk factor, adding smoking to the pot just magnifies and multiplies that risk multiple times. Cutting down is not enough. I'm afraid when it comes to smoking, the only valid advice is stop smoking. There are various ways we can help. There are smoking cessation treatments. There is counseling available. But please stop smoking. Now, as for alcohol, I'm much less categorical on that. There are safe alcohol limits. You can just Google safe alcohol limits. They differ for men and women, but in general, you need to know units. So how much are you drinking in terms of units? If you look at bottles, most of the bottles will have a unit mentioned on them. And if they don't, please use your smartphone, Google it. Safe alcohol consumption is fine, but don't binge and don't exceed, because diabetes is also a risk factor along with obesity and with bad cholesterol levels for something called fatty liver disease. That fatty liver can progress to permanent liver problems, and alcohol is certainly a risk factor for liver damage, and both together can put your liver in a really, really stressed position. So safe limits, yes. Binging and overindulgence, definitely no.
Yeah, like you mentioned that liver, and it basically we want to prevent metabolic syndrome. We do not
Absolutely.
want, yeah. So
And remember, alcohol is empty calories. Most cocktails,
exactly.
mixers in them is empty calories, and you've got to take into account that alcohol calories into your daily calorie consumption and allowance, because otherwise all you'll end up with is with that beer belly. Because of beer or otherwise, you'll still end up with an abdominal circumference, weight around your middle, which is for you.
Yes, like central obesity, something which we're not looking for.
Which we don't want. Absolutely.
Yes, yes.
And
Doctor,
also, can I just add?
definitely.
Consumption in tobacco should not be a taboo topic. Again, in our society, unfortunately, people are unwilling to discuss these.
I know.
With your children, discuss it with your families, discuss it with your dependents, and most importantly, discuss it with your doctor so that you understand what you're saying.
Oh, yes.
And get your information from reliable sources. But please have those conversations. Don't just shove it in a corner and neglect it or ignore it.
Yeah. So I have like so many, relatives or friends who are younger generation, who come for diet consultation, and then they're like, I ask them, do you smoke or drink? And then they're like, yeah, we do. So, but don't tell this to anyone.
The number of doctors who don't ask that question to women,
I know.
the number of healthcare professionals who assume women don't smoke or drink is astounding. And I'll tell you, this generation no longer valid.
And
for everyone, universally.
Yeah. And then my next question to them is, have you informed this to your doctor? No. Why?
They didn't ask.
I'm like, but you should tell them. They will treat you accordingly. Why are you going and, what's the use of the consultation? You took an effort, but you have not even passed on the entire information to the doctor. How do you expect the doctor to improve your health? You need to tell everything. Have faith.
Most importantly, the medication we use, we may need to change depending on your smoking and alcohol consumption.
Yes.
So please be open. I mean, you don't want a third person in the room when you're having this conversation, absolutely fair. But do share it with some healthcare professionals so that we can guide you.
Please, I totally agree to this. This should be shared and openly being discussed. If you have issues, this should be managed, but definitely be discussed. Doctor, going to relate everything now, whatever we spoke about diabetes, lifestyle management, dietary patterns, smoking and drinking, family pressure. How does all this affect the mental health of a diabetic person? How can we manage this?
We know that people with diabetes, for example, have a higher instance of depression than people who live without diabetes. We know that being a carer for somebody who lives with diabetes does put a stress on the carer as well as the person living with diabetes. We know that diabetes imposes a financial stress for most families, which then adds to their mental health welfare. Again, if we don't ask, we'll never know. I think this is a conversation that as healthcare professionals, we should be initiating. But as people living with diabetes, don't feel shy, don't feel inhibited, don't hesitate to bring these things up. If there are issues, see, if you are not able to fully take care of yourself, it's going to impact on your diabetes control. It doesn't matter what I write on the prescription. If after you leave my room, you're not entirely happy with The suggestions I've given you, you're not able to eat healthy, you're not able to exercise. I can write anything I want on the prescription. It only works if you're fully engaged with it and if you're fully able to look after yourself. And if that is impacted by any mental health issues, and it doesn't need to be major, even anxiety of the diagnosis, family pressure, societal pressure, anything, you might deem it minor. You might think, oh, it's not a big thing, I don't want to discuss it. Or you might think, how can I discuss this? But at least drop a hint so that we can catch that little thread and try and get to the core of the help that you might need.
I totally agree, because financial burden and having diabetes at an early age, or maybe at a teenage, when you see your other friends enjoying and leading normal life and you have to prick yourself every day to take insulin, then running away from it, not wanting to take, basically, there are a lot of issues, children and adults, like I think every age group who's suffering from diabetes does has a mental breakdown, which should be discussed and taken care of.
The health issues are varied. So, for example, I'm looking after a tiny one, 7-year-old newly diagnosed with type 1. In her society where she lives, she's the only child living with type 1. The other children that she goes out to play with don't understand it. You can't blame them, they're children. But she feels excluded, she feels stigmatized, and at 7, she understands discrimination now. That's a burden that no child should carry. Teenager living with diabetes who can't maybe go and have a party with their friends, they think. But have that discussion. I'm sure there are safe ways in which we can teach you how to have fun and manage your diabetes. A young pregnancy, the anxiety there is different. A young parent living with diabetes who has the financial future of their family, the health and well-being of their family on their shoulders, their stress is different. The pressure that an elderly patient and the elderly parent feels, that they're being a burden, in inverted quotations, because we never perceive it as a burden, but they might feel that they're putting a burden on their family as a dependent, as somebody who requires maybe a little bit of extra care. The stresses are manifold. And to be honest, we need to be open and have these conversations. We need to have these conversations around healthcare, mental health, because there is no one problem that everybody experiences and there's no one solution that suits everyone. We really need to have these conversations.
I totally agree on this. Doctor, this was a very, very insightful session. I would really like to thank you for guiding us and joining us and educating us on such an vital topic and that affects millions across the world. It was really, really insightful, Doctor.
Thank you so much. I mean, World Diabetes Day, we do it once a year, but we live with diabetes every day. And let me tell you, there is no other aspect of life where lifestyle makes such a huge difference. And by lifestyle, I'm talking about eating healthy, eating at the right time, getting enough sleep, managing your stress, exercising, sharing any health concerns, screening. Let's talk, for people who are healthy, for heaven's sake, do your screens and stay healthy. For people who are living with a condition, do your regular checkups and stay healthy. Prevent complications, but engage in that conversation. Make those lifestyle changes. Stay healthy, stay safe.
Totally agree to this, Doctor. Thank you so much once again.
Pleasure.
And thank you so much, everyone, for watching this session and being part of it. We will be right back with another Health from Home session. Until then, stay safe, stay healthy, and stay happy. Thank you.
Bye. And thank you for inviting me. Bye.
Thank you.